Hi, this is Dr. Jason Tripp. I'm a chiropractor and a naturopath. And today we're talking about migraine headaches. If you're having a headache, even a tension headache, but specifically if you're having a migraine headache, you're getting the aura, your vision starts to go, you got to go into a dark room, no noise, and just like sleep it off type of problem. If that's what you've been having, there may be an answer for you. Now, I want to communicate back and forth. So if you're having any kind of migraine symptoms, then just put yes in the comments below. Just mark in there, yeah, that's me, or hey, I've been having some migraine headaches. Also, if there's questions that I haven't answered at the end of the video, then go ahead and feel free to type those in as well, and I'll get answers back to you as quickly as I can. But when you're having a migraine headache, there are so many factors. Like there's over 100 different types of headaches. So I'm not going to go into each of the different types and how we do all that. But we diagnose, it's a migraine severity exam. So we want to go through and find out how bad the problem is, not how bad the pain is. Everybody with a migraine would tell you this pain is off the chart. Like it is beyond what I can handle. And so if you've ever had a migraine, you know exactly what I'm talking about. But we want to say your problem can be a little problem causing a lot of pain or a big problem causing a lot of pain. If it's over 85%, probably not going to be helped in a naturopathic or chiropractic office because it's tending more to a permanent problem. But if it's less than 85% on that severity score, then almost always we're going to be able to see improvement and or total reversal of those migraine headaches. I've had a gentleman come in, he had over 50 years of migraine headaches, and it took me about 3 months, and we stopped the migraines. He doesn't have migraines anymore. I had a young lady come in, and she was having headaches for years, and nothing was helping, and we figured out exactly what it was caused from. In her case, it was a pinched nerve in the spine right here, and we reversed that pinch. And once we reversed that pinch, she was able to stop having headaches. So if you're struggling and you're having headaches, I'm going to tell you, we got to find out what's causing it. Is it a blood flow issue? Is it a pinched nerve here? Or maybe it's a combination. Maybe it's a pinched nerve here that's blocking the nerve that makes the blood flow properly. Therefore, you're having a combination of both. Like there's a lot of different factors that can go into it. So I'm just going to say that what we need to do is find out exactly what's causing yours. So if you have migraine headaches, and you want to find out how bad they are, come in and ask for the migraine severity exam. Or if you have a friend who has migraine headaches, I want you to share this video with them. In other words, a lot of people have headaches or migraines and they don't know what to do. They're just always missing work, or they're struggling to kind of keep up with life, or they're not able to, really fully be there with their children. And I hate to see that. So we want to not, let that continue. Share this video if that's the case. But if you're having a headache, we need to find out why it's happening. So that's during that exam. And then secondly, we want to find out how bad it is. Once we find out how bad it is, that tells me how the treatment should go. Short treatments, moderate treatments, long-term treatments that basically help you to reverse this condition. And then whatever's causing it, we have multiple therapies for it. So we use some electrical therapies. We use some physical therapies. We use some therapies that are specific to headaches, even things you can do at home to reverse the pain. When you get a headache, one of the things to try is obviously go in a dark room, close the door, get the lights off, no sounds and noises. But you can stretch the neck muscles, and many times you'll relieve it, not because it's a muscle problem, but because when that nerve is pinched, it'll contract all these muscles and cause pain. And so a lot of times that's it. Other times it's something simple like a trigger point where toxins get stuck in the muscle, and when you press here, you can feel it up in your head. Now, if you press here and you feel it in the head, then we have to get that out instead. It's a referred pain pattern from either nerve or just a trigger point. And so we just need to look and see which it is. So whichever one it is, there's even more than that. I'm running out of time, but I want to make sure you understand there's a way to measure what's causing that migraine, what's causing your headache. It's a migraine severity exam. And then once we figure that out, you can actually figure out a treatment to actually get you back on the right track. You just need to get the right doctor to look at it, and you can start to reverse it. So if you've been struggling, or if you're watching this for somebody else and you said, you know what, I know somebody who's struggling, leave a comment below, ask a question if I didn't answer it, because we couldn't get to everything in this short video. But definitely call the office and get registered for the neuropathy severity exam. That's 724-342-2225, and ask for the migraine severity exam. And I will talk to you soon.